Is gene therapy right for me? Is one of the most common questions people have about gene therapy. Every gene therapy is different, even if it's treating the same disease. That means that each gene therapy has different guidelines around who can receive it. This is called eligibility criteria. Many things go into determining eligibility, which a doctor can explain. However, there are two important criteria anyone considering Duchenne gene therapy should understand. First, a doctor must confirm a Duchenne diagnosis. They will do this with a genetic test that looks for change or mutation in the dystrophin gene. This mutation causes the body to not make enough dystrophin, a protein the muscles need to work correctly. Since gene therapy is meant to address the underlying cause of Duchenne, it's important to confirm the diagnosis through a genetic test. Second, anyone considering gene therapy must be tested for pre-existing antibodies to the gene therapy product they've chosen. Antibodies are part of our immune system. When someone is exposed to a virus or bacteria, the body creates antibodies to fight it. These antibodies stay in the body so it can protect against the same virus or bacteria if it ever comes back. Why does this matter in gene therapy? Gene therapy uses a vector to deliver the therapy to the right cells. These vectors are similar to viruses that occur naturally, but they are modified so that they can't make you sick. If antibodies related to the vector are in the blood, they could prevent the gene therapy from doing its job and could cause harmful side effects. This is why it's important for a doctor to order a blood test to look for antibodies that recognize the vector used in that gene therapy. If the levels are too high, that treatment may not currently be an option. These eligibility criteria may change as more is learned through ongoing research. So, it's always best to talk to a doctor for the most up-to-date information. So, what did we learn? Every gene therapy is different even when treating the same disease. Each gene therapy has its own specific eligibility criteria, and there are two guidelines that are broadly required for a Duchenne gene therapy. A Duchenne diagnosis confirmed by a genetic test, testing for pre-existing antibodies to the vector used in the desired gene therapy. For more information, reach out to our patient advocacy team by emailing advocacy@sarepta.com, and be sure to visit Duchenne.com to sign up to receive updates and access additional Duchenne resources.